this video, we're going to talk about the big event, the pushing out of your baby. So there's two things that I like to think about when training the body how to safely push out this baby. And two things I like to consider. One is your posture. We want to keep our ribs stacked over our pelvis. And the other is how we breathe. So there's two really main ways of breathing or pushing breath during delivery. They're called purple pushing and gentle pushing. Both of them have a role. Gentle pushing is just easier on your pelvic floor, so the more often you can use it, I think the better. Purple pushing is when you really bear down and hold your breath, like you see in the movies a lot of times, which you may be encouraged to do at certain times during the pushing phase of labor. But really, I think focusing on this gentle pushing is really beneficial for that pelvic floor. So, ribs stacked over hips, no matter what position you're in, whether you're lying down on your side, leaning forward a little bit. And this is because if you're extended, it's harder, these abdominal muscles are lengthened and it's harder for them to contract to really help push that baby down. Similarly, if you're asked to kind of go forward this way, to curl forward when you're pushing, which sometimes they ask in purple pushing, this shortens these muscles and makes it harder for them to contract to help push the baby down. So if your ribs are stacked over your hips, you're really in the most optimal alignment for pushing. The second component is the breath. So with gentle pushing, we're going to use that breath that we've developed with our core, our modified core breath, where we keep the pelvic floor lengthened as we exhale. And what this is called is open glottal or open glottis breathing or open glottis pushing. So what I want you to think about is keeping your mouth open as you exhale. What this does is it decreases the pressure on the pelvic floor and makes it a little bit easier for baby to move through that space. So as an example, when it's time to push the baby out, instead of this, you want to think, it's good to practice on the birth ball because it gives you a lot of good feedback to your pelvic floor and also helps kind of with the stacking of your posture. So give that a try and please send any questions. This is kind of different and new for everyone, so I'm happy to answer any questions that you may have.